Have you ever looked in the mirror and thought, when did this happen? It feels like aging happens overnight. One day you look at yourself and the next day you look tired, older, and different. The truth is, however, it didn't happen overnight. And once you understand the tipping point, you can actually do something about it. If you're new here, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon with over 20 years experience helping people look as young as they feel through natural facial rejuvenation and clinically backed skincare. On this channel, we break down what really causes aging and how to approach it intelligently. If you want honest guidance about your face and your skin, hit the subscribe button so you don't miss what's coming next. Biological aging is gradual. Collagen declines about 1% per year after your 20s. So somewhere in the mid-20s, this process begins. Fat pads slowly lose volume, especially around their eyes and around the mouth. Ligaments throughout the face start to loosen, but your brain doesn't register how slow these changes are happening. It registers a tipping point. There comes a moment when enough structural change has occurred that your face crosses a threshold and then you suddenly see it. And this is literally something my patients talk about all the time. Whenever they're sitting in a consultation, it's always the very same thing. I don't recognize myself. It feels like literally overnight, suddenly I look like a different person. I don't want to take pictures anymore. I don't want to be on video or on Zoom meetings, etc. I mean, it's really sad to say, but a lot of people stop even wanting to look in the mirror because they don't recognize the reflection on the other side. The real reason people seek treatments is because of this sudden change that occurs. Now, for a lot of people, they try to anticipate this and they're doing things early on to prevent this moment from occurring. But even in those cases where people are using Botox and fillers and all these other things, that moment suddenly becomes inevitable because, as you'll learn, there are reasons why that is happening, and there are things that you can control and things that you can't control. And I'm going to share all of that with you in a moment. So before we do, let's talk about the heart shape to rectangular transition. When we're young, the face has what I call a heart shape. And that's not that it actually looks, like a classic heart, but what it is it's wider and thicker on the upper portions of the face because the cheeks are up in their natural position. The temples are a little bit fuller, then gently tapers down towards the chin. So you get this kind of reverse triangle or heart shape. Part of the reason for this is that cheekbones, which is composed of bone covered by soft tissue, appears thicker because the cheeks and all that soft tissue are up and over the cheekbones. It's not that they're filled and overly volumized, it's just that their natural position with the soft tissues laying over the bone gives you a fuller look. And the jawline, because things are narrow down here, because everything is up, you see the outline of the bone, and as a result, it looks defined. And because all of this is pulled upward and the neck is actually attached to the face, when all of this is up in its youthful position, guess what? The neck is clean. You see all the angles, everything looks taut, and that's the youthful shape of a human face. As we age, however, there are three major things happening at the same time. The skin begins to thin, it loses its luminosity, and luminosity is the light reflex, right? That look when light bounces off the skin, it has that vibrant glow that we think about. Luminosity occurs because the skin doesn't have any dead skin layers on it, and as a result, it is bright and fresh looking. Now, as far as volume goes, and these are fat pads throughout the face, primarily around the periorbital and perioral regions, what ends up happening is you begin to lose those fat pads. And the deflation causes a gaunt look around those areas. Now, this is probably the most important thing. So we talked about skin, we talked about volume. The third component is the soft tissue envelope that really holds the entire face together, and it's held up by ligaments. This begins to lengthen and give way. This happens typically in the late 40s and early 50s, and as a result, the face begins to elongate. Coupled with the deflation, coupled with the changes in the skin, you look more tired, you look more aged, and frankly, suddenly you no longer look like yourself. So when these three things or these processes converge, the face slowly transitions from the heart shape into something more rectangular. The upper face narrows, the lower face widens, the jaw becomes heavier, the neck becomes thinner and more loose. The cervical mantle angle, which is this shape between the chin and the neck, begins to soften, and as a result, you get a more obtuse angle in that region. And that's what feels unfamiliar because you no longer have the shape that you did when you were younger. You're not seeing wrinkles, you're seeing a different geometry. And this is very, very important to point out because once you understand what is actually going on, it will inform the choices that you make to try to remedy these problems. It'll keep you from doing things that are going to be unrelated to treating these particular areas. And frankly, these are half of the issues that cause people to go down, basically blind alleys, spending a lot of time and money and end up being disappointed by the results that they see. And worse, sometimes coming out looking more aged and more unusual because of the treatments that they undergo. We spent a lot of video time speaking about these, and I definitely urge you to go back and take a look at some of these videos so you can understand this in a little bit more detail, but this is the gist. For many people, especially women, this tipping point is accelerated around perimenopause and menopause. And this is because estrogen, which supports collagen and soft tissue integrity, as it begins to diminish, these shifts occur. No one knows exactly why that trigger happens, at what point in the estrogen collagen curve this occurs, but we just know that it's almost ubiquitous that right around perimenopause and menopause, we start to see a shift in women's faces. Men lose collagen too, but the change is more gradual. It doesn't have that big accelerated bump that happens right around perimenopause and menopause. And what's interesting and fascinating is when people have oophorectomies where they remove their ovaries and they're put into a medical induced menopause, even if they're younger, these changes start to happen. This is kind of an observation that's been around for a very long time, but really is correlated with the hormonal triggers that shift and accelerate this process. And once this occurs, skin quality begins to decline faster, volume loss increases, and the tissue descent becomes more noticeable. It didn't happen overnight, but once it gets past a certain level and the rate has changed and accelerated, it feels and appears like it occurred overnight. Or, like in my wife's case, she felt like within a 6-month period, all of a sudden she looked totally different. And frankly, she did. It really was a real thing. Right around 52, suddenly she just started to shift and really started to look different in terms of her facial geometry. This is when frustration sets in. The things that you used to use to refresh your appearance, things like a little bit of Botox around the eyes and the forehead, a little bit of filler, maybe a laser, suddenly don't have the same impact. So what people often do, they do more filler, more tightening, more treatments, more frequently. And frankly, all of these things start to shift and change the face, but they don't stop the underlying problem. And as a result, aging continues. Because if the core issue is the change in the shape, adding surface treatments doesn't restore geometry. It can actually distort it. And this is when people start looking overtreated or morphing, not because procedures are inherently bad, but because the strategy is incomplete and is misaligned with the fundamental problem. And that's the beauty of understanding these things at the fundamental scientific level, is that you as a consumer who's out there trying to solve these problems for yourself, you're not going to be misled when somebody tells you, hey, let's put more filler in your cheek to lift up your jawline and your neck. And then you realize, you know what, the problem isn't more volume, the problem is sagging, so that's not going to solve the issue, and it's going to save you from going down the wrong roads. So there's also a deeper truth here. As a species, we're living far longer than we were evolutionarily designed to do. Many of the structural changes we're now reacting to are a result of the good fortune of longevity. Most people don't realize this, but prior to 1919, life expectancy was in the 30s and 40s. People were dying mainly because of bacterial infections and different things like this. And then suddenly in 1919, when penicillin was discovered, life expectancy shot up again. And we're living a lot longer as a species than we were normally intended to. And as a result, we're experiencing the physical changes that occur with older age, but psychologically, we haven't evolved to adapt to watching our facial proportions change. And therefore, the desire to look as young as we feel isn't just vanity. It's tied to identity. It's neural, it's innate, and it's shared by every single patient I've ever treated. So I'm going to share with you basically my life's work when it comes to understanding problem which we just outlined and the treatments associated with it. What actually works and what will work every single time. So you can't correct this by treating one layer alone. You must address all three components simultaneously: skin quality, volume, and shape. I've been doing this for 20 years and have realized that the magic of looking naturally rejuvenated, looking as young as you feel, really comes down to addressing all three of these things. And I've literally devoted my entire practice to effectively creating natural rejuvenation. In my surgical practice, that has come in the way of a vertical restore, which is really an evolution of minor changes over a 20-year period to create these very, very powerful natural rejuvenation of facial shape. So vertical restore addresses shape. And I've also learned treating volume is best served with a fat transfer in very specific areas. So what I mean by that is not all over the face, specific areas that you've lost volume. So areas like the temples, above the eyes, under the eyes, around the mouth, a little bit of volume. You're not putting it in the cheeks. This changes your look. Replacing volume in areas that you've lost volume just simply replenishes where you've lost it, and it looks normal and natural, and you never look cheeky and overfilled. And then finally, treating the skin. This has been probably one of the most challenging areas to figure out how to manage skin aging. But honestly, I figured it out. It requires, first and foremost, total dedication to sun protection, because sun is an incredible activator and accelerator of skin aging. Things like collagen loss is accelerated, pigmentation is increased, dehydration is increased. All these things are increased with sun exposure. So being good with sun protection is an extremely important part. We've talked about this in other videos. In addition, using actives. Not all skincare is the same. And many of you probably have an entire drawer filled with things that don't work. But I'm a huge believer in daily actives used on the skin will change the way the skin responds to aging. So if the fibroblasts are decreasing the production of collagen, well, things like retinol, vitamin C, and niacinamide and peptides are going to increase the production of collagen and make the skin cells behave more like younger skin. That's the theoretical concept of actives, is they're making the tissues function more like younger tissue. So what I have done personally for my patients and for many people who use it, I basically took all of those actives and I've created the trifecta. You've heard about this before, but it really has changed the game for our community who uses it, because the skin is getting younger appearing, more supple, more youthful. And if you don't use the trifecta, make sure you're on the actives that are in the trifecta. Take a look at the website and learn about them. But that is really the key. It's not lasers on a regular basis. It's not chemical peels on a regular basis. It's not microneedling. Those things are great additions, but they are not the foundation. The foundation is sun protection and daily active skincare. That will make the difference in terms of how your skin ages. And that's key. So when you put all these things together, you formulate effectively a combination that addresses shape, volume, and skin. And that is where you start to see true rejuvenation happen. And for those of you who want to get in front of the aging process, well, you do this earlier than later. Start taking care of your skin when you're younger. My wife was all over her skin doing exactly the things that I'm recommending. In her 20s, mid-20s, she got started with all of these important actives, and she's 53 and has skin that's better than it was in her 20s. And then when the time comes, you do a vertical restore or some type of facelift at the right time, and then you do some fat transfer simultaneously. And if you don't have access to fat transfer, then you use fillers to replace the volume that you've lost in the specific areas that I just mentioned. And when you do all that, suddenly, boom, your geometry is restored, your shape is restored, and you get in front of the aging process, and suddenly you no longer having to see this sudden cliff that drives everyone crazy when it occurs. So if this is helping you understand what you're seeing in the mirror, take a second and subscribe. These conversations build on each other, and I want you to have the full roadmap and see these videos next week and the following weeks. All right, so some final thoughts. Aging rarely happens overnight. It's a very, very predictable process, but often becomes visible overnight as you cross a threshold. Once you understand the geometry shift, the transition from heart to rectangular, you stop panicking and you start planning. That's the key. So if you want to learn a little bit more about our approach and my methods, definitely take a look at the websites, drkaram.com and karammdskin.com. You'll learn a lot more about both of these concepts. And don't forget to read more about skin health and how to age gracefully, and subscribe to the Karam MD Journal. It's a free resource to help you look as young as you feel, and it comes to your email inbox every single week. And if you enjoyed this video, make sure you hit thumbs up, add your comment, let me know if you've learned anything, any questions you have. I'll do my best to answer them. Thank you so much for watching, and until next time, Dr. Amir Karam.